Good morning, everyone. Nice to see you all here. It's great second morning to have an opportunity to address you guys, having had the privilege of sitting through yesterday, which was an amazing day. I usually don't get the opportunity to actually sit and absorb in conferences as much, and I was overwhelmed with the amount of knowledge and passion and energy and enthusiasm and just smartness that's in this room and the good stuff that's going on. So I felt like I really learned a lot yesterday, which is terrific. And I also felt like I always, when I'm in a situation like this, I always kind of recognize how little I actually know relative to everything that's out there that's going on. So it's a very humbling experience. The more you know, almost it feels like the less you know as you go forward and things like that. So I'm delighted to be able to be here with you today. And contrary to what the agenda says, I'm not going to talk too much about data and outcomes, especially based on the conversation and the work that's going on here and the opportunity that I had to speak with Richard and Elizabeth and others yesterday about where this is headed and where we're going. So what I wanted to do and what I'll do is share some kind of macro perspectives on what I've been doing and what we've been doing at Stewards for, I guess, about the last 15 years or so around collaboration building and around data sharing and interoperability. All are connected to the work that you're doing here, and I heard so much about yesterday, trying to connect systems and to connect people and to connect processes to really drive to better outcomes. And so we've been on this journey for a while. And I thought it would be kind of a nice opportunity to sort of start at a kind of a 30,000-foot level here, since yesterday was so much into the details, to try to lift up the conversation a little bit here. One of the questions I wanted to start with for a second, which really struck me yesterday, and is how do you know what's going on outside of your county? How do you know what's going on in other counties across the state who are doing innovations or doing stuff that worked or didn't work, for that matter? Let me see a show of hands if people say, oh, I've got visibility, I know what's going on, I'm really tracking everything that's going on in the other parts of the state. All right, we got a couple of tentatives in the back there. And for those of the other folks, let me make the assumption that that may not be so visible to you, right? That's not really terribly surprising. And that is one of the things that has really motivated me over the years, is to try to figure out how to take the knowledge and the wisdom and the experience that's happening in one place and create visibility for it. Because there's a million things happening across the country. Probably literally a million things happening. Under the prior administration, there were billions and billions and billions of dollars invested in R&D and innovative programs. And you know what, folks? Those things are still happening, and they're coming to light now. And a lot of those seeds that have been planted are here, and they're all around us. And what I feel that we need to do is to make sure we're keeping our eyes open to those investments, because they're all over the country and actually all over the world in many instances. And we shortchange ourselves if we don't keep our eyes open, and if we don't have means to look outside of where we work every day to see what else is going on, so we can ideally learn from others and, as importantly, avoid some of the pitfalls or the errors or the mistakes that people are making all over the place, so that we can potentially avoid some of that. And so we've been dedicated to that work and trying to lift that up, and hopefully, as I get through this discussion today and as we get through today, we'll leave you with some optimism about how we can help do more of that in the state. So you'll notice that here on the screen is one of our murals that we actually did here in California, and this is from 2013, actually. And if you can read that, there are a few things that are still in the conversation. How do we make change? How do we bring visibility to the work we're doing? How do we have a complete, 360 perspective of the child and the family? So back then we were involved with the state, actually prior to that, working across the state to try to build the state's interoperability plan. which was funded by an OMB and an Administration for Children and Families grant, one of 7 that was awarded across the country, helped the state do that. And we had the opportunity to work with counties. We brought a lot of folks from the counties and the associations in with the state to actually co-create that work. And some of that still exists, and some of that actually has been put into play. But it was an amazing opportunity to actually bring people together, using actually a SharePoint, an earlier version of SharePoint, to actually leverage and motivate people to collaborate across the state in terms of what kinds of changes, what kinds of things were really useful and interesting. And I just share that to say that there has been work going on, and that I encourage us to look back sometimes to see what people have been thinking about and how do we move forward. On some instances, there has been a lot of progress, and there's also not been a lot of progress in a lot of areas. And that's true not only in California, but as we've been having these conversations across the country, this work takes a while. It's hard work when you start to cross those silos for all sorts of technical reasons. And we'll get into some of those as we go forward here. So I'm going to share with you, I'm going to do a little tiny bit of background, and then there's a couple of topics I want to touch on here. Some of which we heard about yesterday in some degree, and some of which I'm not sure, well, we didn't hear about yesterday, I want to share with you. So one is social determinants of health as it meets medicine and healthcare, right? So there's this intersection that's beginning to happen in a very powerful way that's important for us to recognize. Some models and conceptual tools that we have been able to evolve as a result of conversations and work we've been doing across the country that might be of use to you and that are available and will make available for you as you think about it. Now, this is kind of the data part of it, is some work around artificial intelligence and natural language processing. How do we apply that in this setting? Because the kind of stuff we're talking about here goes beyond the kind of computing that we're used to doing now, which is kind of a program-based, predictive kind of statistical-based approach. It's requiring us to do and think very differently in terms of accessing the kind of information. So there's some early things that are happening there that are interesting. I'm going to talk a tiny bit about opioids. Is anybody in this room not dealing with opioids in some way? Unfortunately, not surprised. And then I want to spend some time on the National Interoperability Collaborative, because I think that, in many ways, is a way forward I'm really excited about, and that I hope that you will as well. So we're going to try to cruise through that. I'm going to get my phone out. I don't know if anyone's keeping time for me, because I am not always the most punctual person on that. So, in the beginning, as they say, so we've been doing this work for a while. As I said, we had the great fortune of having some support from the Annie E. Casey Foundation a while ago. As we got to know them in New York City. We were working on child welfare and foster care recruitment and retention back then, a while ago. And one of the questions that came up is, who is doing work across the country? Who's doing work that's innovative and focused on data sharing? So we had the great fortune of being able to go around the country, visit a bunch of, turned out mostly counties who were doing the innovative stuff across the country, which is still, in many ways, the actual situation. And really learn about what was happening. So we came to California, went to San Diego, went to Santa Clara, Ventura a little bit, and then some other places around the country in Maryland and in Michigan and in North Carolina, and had the opportunity to really hear from leaders and look at what they were doing that were similar and different. And we found a lot of convergence in what they were doing and how they were approaching it, except they were working in their own silos, so they had no idea. So everybody was recreating a process by which they were trying to do transformational change in their organization. So we decided that that wasn't a smart thing to do, and that maybe we ought to start bringing people together, like this kind of convening here and starting to share stuff. So we were able to do that, and we've been doing that for the last 14 years in different locations, most recently at the Johns Hopkins School of Public Health and Medicine. And so from that opportunity, we were able to learn from the leaders who were doing this cross-system work, sort of distill it, summarize it, and then publish some of those findings with some of the people in this room who will participate and who you'll hear from next, actually. So that was a great opportunity to really distill information and learning from those different organizations. And then what we did is, as we synthesized that and started to publish that stuff, we decided, much by chance, to start to graphically illustrate our work. What I found over the years is that you go to a meeting and you get a 75-page summary of the meeting, and it becomes really a beautiful sort of doorstop for you. It's actually a guilt-provoking thing that sits on your desk. I've got to read that because it was so important and I didn't get to it. And it's good stuff, and I'm sure there's a bunch of people who love to read those things and highlight them and really learn from them. But I know myself, it's really hard to do that, and it's hard to remember, and it's hard to share that with other people when I go back home, right? That's the part that really struck me. Is how do you take the knowledge from a convening like this and share it back home? And so we started graphically illustrating our work. And here are 3 examples of different conferences or different events that we were at, anywhere from strategic planning work to just capturing work in convenings, and then some innovative work around actually using personas, which I'll talk a little bit about. How do we get people to think about it? And what we found was, guess what? More than half of the world are visual learners. So they really understood it. And we worked with some amazing artists who were able to both hear, synthesize, distill, and draw and write at the same time. I have no idea how they do it, but it's amazing to watch. And they capture the notes in a way that are really useful. Most recently, we did a project in the state of Connecticut with actually a strategic planning process, and we mapped the whole strategic plan on one mural, which everybody now has on their desk, all 1,600 employees. So it becomes a tool for communication in a consistent, sort of summarized way that's very powerful for folks. What we began to do recently is, just this last spring, is to put these murals together in a gallery. So we were able to work collaboratively with San Diego County in their summit last spring. Anyone was at the San Diego summit? Yep, okay, back there. So you might have been to the gallery, I don't know. So that was the first time we did it, in the sense of trying to distill this body of knowledge, because they're not just pictures, but they actually contain a lot of the information and knowledge that people have shared with us over the years. So it's actually kind of a living library of knowledge. What was interesting is you go through this, people would walk up to it and say, oh, that's from 2000 and whatever, that's still relevant. We're asking those same questions still. So it's become a repository for information sharing. And we've done it a couple of more times, and we're really thinking about it as a way to share that information broadly across organizations, and it's very portable. I like to say it's a way to make thinking visual and to activate whole brain thinking, teaching, and learning. And that's a really useful tool as we try to share these complex ideas, right? Because they're really complex when you're crossing domains. And it's a way, again, to share what you've learned with other people. And it's a way to engage people from other domains as well. So when we're sitting with education or public safety or public health or healthcare, you can actually see the ideas, right? So people can actually see it and they can begin to point at it. And that's particularly true in work that we've done around personas, where you actually bring the voice of the customer, or the voice of the consumer, or the patient, or however you refer to them, into the room. We always talk about that. We want to make sure that we've got the customer's voice in the room. And by doing personas, and if you explore that a little bit later, you'll see that it really talks about this particular case, Antoine Baker, who's a foster kid, who, as we chart this out in terms of what the system requirements are and what their individual requirements are. So it makes it incredibly visual. I'm not going to take time to go through it, but there's a link on here. I think we're going to post all of these afterwards on the site, so you can look at these on our website. There are literally more than 100 of these murals, and there's some video of the gallery itself. If it's of interest, it's a good way of looking at these kinds of things. And it's also, as I mentioned before, it's a way that is supporting this building of the national collaboration, of the National Interoperability Collaborative, as we refer to it as a community of networks, because those pictures, those ideas are transferable very readily. So I probably don't need to say or to talk about the case for information sharing, why that's important. I think probably all of you can articulate the importance of that. But I've got a slide, so I'm going to talk about it. Having started this work after having worked in the private sector for a decade, coming to this work, and the inability for information to be shared readily across systems was the most striking thing that I observed 15 years ago. And I think that very much exists today in many, many systems, our inability to do that. And the result of that, of course, are children, not only children, but others who are hurt or in some instances killed. And the core finding from those kind of reviews, as you know, often comes back with, well, we knew all this information. It was in all these different systems. We just didn't have access to it in a timely fashion. So the information is out there. We don't have access to getting it. We can't make decisions in real time as a result of that. And that's due to a whole bunch of things, including legacy technology, rigid policies, our kind of siloed thinking, high turnover rates, and this really vexing, complex problem of how do we not only share information, but how do we make decisions based on that. Unfortunately, organizations, I don't think, still yet focus enough time on bridging the silos or working upstream or working on prevention. The daily tasks are so overwhelming that it's very difficult to do that. And we like to say interoperability. Well, does anybody have interoperability in their job title in the room? No, they don't. They absolutely should. In fact, California had one of the first person who actually had that in their title was a guy by the name of Adam Dondro, who works at Office of System Integration at agency. And they actually created a position. It was actually a horizontal integration specialist. And his job was actually to do that. And he was successful at it for a while until he got sucked into many other programs. But when we talk about that, it's that idea of whose job is it to look across programs? And oftentimes it's relegated to somebody, but it's not somebody's job. So we made it our job to try to do that and try to share that information. And as you think about the kinds of solutions and problems that you're dealing with, part of them stem from this inability to share information across. So think about, is there a way to create that role? Is there a way to create that responsibility to actually look across and to negotiate those kinds of change, those kinds of relationships, right? It was all about relationship, as we heard yesterday. So I want to just spend a minute going back to the personas for a second. This is a fictitious family, the Garcia family. It's mom, her daughter who's got a baby, and she's pregnant again. And the way our systems currently are designed are in their silos. Each of them are delivering a variety of services to each of the individuals. Maybe there's a little cross-communication, but there's a whole bunch of stuff that's going on here. Now, I show this for two reasons. Again, a picture is incredibly valuable in terms of just demonstrating the complexity of what we're dealing with here. But more importantly, what I found is for years when I would use the word interoperability, people's eyes would kind of roll back in their head, right? It was like, what are you talking about? I don't understand. Isn't that just kind of a technical problem you're trying to solve? How do you get the machines to communicate with each other? And what this does for us, what this shows us is what interoperability is about. If we can figure out how to share that information so that we can serve this family, to get the services to the person and the people when they need it, that is interoperability. And so for years we were trying to explain interoperability. These three slides actually conveyed and converted many people who didn't really understand what it was, because you could see it in human terms. You could see the programs we're trying to connect. Again, this is something that I offer up to you as a way to think about it. And all roads lead to data, right? If we have the data at the right moment in time, we will at least be able to try to share what it is that we need to know. And I thought it was wonderful yesterday who was saying data is the new bacon. That was a great one. But don't forget, too much bacon, not so good for you either. So I'm a proponent of data, but I think that we're awash in data, right? Does anybody not have enough data? I think what the problem is, we're on this side now, we've got too much of it, and how do we actually use it effectively? And that's the question for us. That's not the goal. That's not the end point, is the data. The point is, how do we use the data in an effective manner? And that becomes all the more important when we start to talk about social determinants. And I always emphasize, especially when I'm in a crowd of more health focused, that it is the Health and Human Services Agency, right? Human Services is part of it. There's two H's in there. In the same way, there is the social determinants of health. I'm a little concerned about the medicalization of SDOH, and now that the medical community has kind of woken up and said, oh my God, there are all these things out there that really matter for someone's health. Welcome to our world. It's taken you a while there. Which is great. I mean, come on in. That's great. Good. Never too late to see that. But now I think we have to be very concerned about not putting medicine in the middle of this equation. And I've been arguing with folks who are actually devotees or zealots within the medical and the healthcare community. They've come to it so vigorously that they see all roads lead to the physician. And I don't think that's the right place for this to exist in our larger systems. It's not an affordable proposition. The rates are so different in terms of that, the training, the accessibility to information, the accessibility to time with patients in the room. You don't have time to do that necessarily. And I think that we need to guard against that as we talk about it. Health has to be part of it. As we know, healthcare, sort of contributes whatever, if you believe the numbers, 10, 15, 20% of one's health outcomes. All the rest of the stuff is coming from social or environment or behavioral aspects. So we need to make sure that we're balancing out where and when and who is contributing to it. And I'm a little worried, as I said, about the enthusiasm coming from the healthcare world. A couple of weeks ago, I was at a conference in Boston, the Connected Health Conference, which was, it was digital health. I mean, it was as healthcare as you could get, digital health and telehealth. 2,000 people in this conference. We had our mural gallery up, and I was actually wondering if anyone was going to walk in at all, because you go to a digital health conference, for those of you who go to conferences frequently, they're so high tech, right? That's all about slick, shiny apps. It's cool if you're looking at that stuff, but it is not terribly human. As my friend used to say, there's a lot of silicon, not enough carbon in the room. And so one of the things that really jumped out at me was these actually are the carbon. These are the people. This is the low-tech, high-touch approach. And I was really surprised and delighted by the people who were walking in. There was a group from Mount Sinai Hospital, 7 hospitals in New York City, who are in the process of attempting to implement social determinants of health. They are in the community. They have nurse practitioners in the room. They had docs. They had social workers. They had everybody in the room. And the conversation that ensued was beautiful. It was exactly what we wanted to have, was how do you blend these worlds of this high-tech medical intervention, digital health, with these high-touch, low-tech in many instances, approaches to working with families and children and communities. And it presented an opportunity to actually have those conversations, which is what we wanted to see would happen, if we could actually enter that healthcare realm and see if we could generate interest in it. And I'm glad to say that we were able to do that. So there's a willingness to do it. Going onto other people's turf, bringing our message into their world, whether or not it's healthcare, or public safety, or criminal justice, or education, is important for us to be able to be the messengers and to take our message to them as opposed to waiting for them to come to us and ask us what we need. And this is a way that I'm very excited about being able to do out there. I'll talk a little bit about that shortly. So the growing interest in social determinants of health, I'm not sure if you can read this or not, but just a couple weeks ago, there was an article, I'm not sure how they got this information, but 14 of the nation's leading hospitals and health systems will be investing $700 million to address community health needs. I know Kaiser is one of them in California. There's a bunch of other across the country. So, and if you can read some of the other headlines here, some of the big health providers, the insurers are now moving into this space, as I said. It's a market space they probably see this as. It's an opportunity to grow, but it's also an opportunity to lower costs, improve quality. Hopefully that's the driving factor as well. Relative to a $3.5 trillion healthcare budget in the country and about $1 trillion of human services spend. $700 million is kind of like pocket change. But it's a start, and I think that what we're going to begin to see more and more is that investment, because providers recognize that they have to address and integrate social determinants. How they do that is just starting up now. And there's some really interesting work coming out of actually University of California, San Francisco. There's a group called Siren. And one of the things that they're doing is actually coding social determinants. Because if you look at any of the healthcare records, if you look at Epic or Cerner or Allscripts, they all have social determinants in their EHRs, but they're all different. So there's no standardization of it. There's no way that those things can be billed for directly now. So this program, which has got a huge group of different participants from the federal government, state government, associations, providers, are now methodically working through this issue so that those things are going to be standardized and codable so they can be billed for in a consistent manner. That will be, in my mind, the inflection point where social determinants really is, you can actually implement against that in a way that we really haven't been able to do before, except for separate appropriations and things like that. So the question is, can the silos be connected? You know, who feels in the room that they're actually making some progress in connecting across? Good. More hands. More hands. Stand up and shout. That's great. Right? It's great. It is happening. It's taken a while. It's happening. I was reflecting on some of the commentary yesterday. Well, we've been at this for 25 years, and we're getting there. Great. How do we accelerate that a little bit, right? And that there's all of this work that's going on out there is really, really quite encouraging. One of the things that is really critically important to this cross-domain sharing is the opioid epidemic right now, or method, depending where you're at. A couple of years ago, we wrote a case study, again, trying to figure out how this interoperability work could be more readily shared and exchanged with people across in leadership positions. And lo and behold, the opioid crisis was really coming into its unfortunate crisis stages. And as we wrote this case study, what we saw was, I think we found 18 different touch points along the way. Typical kind of case, woman working, hurts her back, gets a prescription, gets addicted to it, gets cut off, has to go source drugs from somewhere else, gets arrested, loses her child, the whole thing. And as you kind of chart through that, which we've done with groups, you see all of the various points where people were more aware, had access to that information, they could ask that question. And so by looking at a crisis like this, as they say, it's, you never want to miss the opportunity of a good crisis to make change. And I think the opioid crisis in many places across the country is actually doing that. It's really forcing people to figure out how to share information more effectively. I'm sure that's happening here. I know that's happening in California in a way. But it's a use case that it's not only a particular problem we're addressing, but it actually underscores all of the other kinds of outcomes that we want to have happen. So if we can be successful addressing this crisis, those changes that are made will allow us to do the work that we want to do proactively or positively in terms of making the connection. So not only can we do treatment, but we can actually start to move upstream on prevention and early detection. And so, again, this is a resource that's available online. There's a whole section on interoperability at the front of this thing that also describes a lot of what I'm talking about here. So a little bit on some models. One of the things that I've also discovered over the years is that everybody has a different language and vocabulary coming into this work. So, I call it a tomato, you call it a tomato. And so one of the things, as I said, we've been able to really look at is how do people use language to describe what it is that they're trying to accomplish. And this is just one very high level kind of a theory of change that says, what are we talking about? You get in a room with a technologist, with a policy person, with your attorney, with a caseworker, a social worker, program officer, a manager, a fiscal person. Everybody's got a different perspective. They're coming at it from a different perspective. We heard that so articulately yesterday around the financing and the funding of that. If you're not a financial person, your head was spinning by the end of that, I'm sure, saying, great, okay, Medicaid, that's it, let's go for it. But which door do we walk through? And so this is sort of just a high-level way to say, are we talking about a policy issue? Are we talking about a structural issue here? The systems can't connect, we can't get to the right place at the right time, we don't have enough resources. Or are we talking about a practice issue? How do we actually implement that at the field level? So it's just a way to start to say, what are we talking about in this conversation, so that you can align and make sure that you're not talking past each other. Because if you've got a policy question happening, somebody's bringing that mindset to it, and you're trying to figure out how to implement that, you need to be able to synchronize on that. So at the center of this model is this idea of, let's just define our terms. What are we talking about when we go into the conversation? There's two other components to this, which is, are we looking for innovation, and or are we looking for outcomes? Now, you can have both, but you can't have 100% of both, right? If you're going to dial up innovation, that means you might fail. You might not get any outcomes. You might strike out. And you have to know that before you go into it, because if you're going into an innovative, if you're saying we want to innovate, we want to fail fast and move forward, but we got to get outcomes. We got to be able to demonstrate to the legislature this is money well spent. Those things are somewhat incompatible. So you have to define your terms to say, you know what, we know what the right answer is. This is not an experimental thing. We know what the research, we know what the evidence says. Let's go for outcomes. Dial that around more. As you're defining this for your leadership and for your organization, what is it that we're talking about? And then finally, what's the pace of change? We got to fail fast. We got to be agile. We got to move quickly. Well, that's kind of a revolutionary kind of thing. We got to move fast to do that. That's hard to do. It's hard to keep that in a busy place. So are we talking about an evolutionary incremental change, or are we talking about a revolutionary fast change, which might mean there's more failure along the way, which means there's greater risk, which means we might not have enough outcomes to demonstrate to the legislature? So on one page here, you have kind of a way to think about this and talk so that you agree on terms as you go into this work. So we talk about this a lot more as you go through it. So when we do strategic planning or we work with groups, we really work on trying to create a vocabulary that they can use as we move forward. And that's important as we think about the complexity that we're working in now. This idea of a cube is a important sort of computational concept. We've got a lot of moving parts here. If you're talking about domains, you're talking about health, you're talking about human services, you're talking about education, public safety, emergency. You've got all these domains against one side, right? You've got all the programs against another axis, right? So what are the specific programs in each of those domains, and then what are the data elements you want? And you've got a consumer in the middle, somewhere in one of these cubes there. How do we bring the computational power that we've got on our phones now, we can do this, so that we are designing our system so we can actually provide the information we need about the individual in the program at the time they want it? That's, again, a slightly different way of thinking about how we want to use data. So we get the information that we need, when we need it, and how we do it. It's not a linear thing. It's a three-dimensional kind of approach. And that leads us to this larger concept. As if interoperability wasn't a more difficult enough term to say, one of the things we thought about was, what does interoperability mean? You look at a lot of different definitions. It really is about connecting, right? I'd like to say it's about the boxes and wires. Can you get the systems to talk to each other within the appropriate legal framework so that the information is available, it's synchronized, the right standards? What do you do after that, right? So we've got it all working. Do we know how to drive the car, right? Somebody's actually built the car. How do you drive it? And so we can't stop at this point of interoperability. It's a way station along the way. So as we were thinking about this, we said, well, what's next? Well, what we want to be able to do is we want to be able to use the interoperability, but we also want to optimize our systems. So we talk about it as interoperability. We want to integrate and optimize. Again, it's another sort of conceptual framework to say, over everything here, we want to be able to use data, we want to be able to use information, but we want to be able to use it in a way that helps us that we're not necessarily able to do today. And so we're not at the end of the journey once we connect all the systems up. how many of you are comfortable with doing advanced statistical analysis, right? Okay, they're all in the back for some reason. All the so right, it's a different skill set, right? It's a different approach. How do we make sure that we are able to take advantage and use that information in a way that can be really productive after we've gone and invested hundreds of millions, if not billions of dollars in creating these systems? We need to make sure that we train people to be able to do that. And that's where this artificial intelligence comes in. And that's where sort of the title for this presentation really comes from, is data and outcomes. And I think that with the tools we've got now, we can do a pretty good job. We can do correlation analysis, we can do regression, we can kind of get a sense of it. But do we really understand what it is that we've got, and how do we make sense of all of that data we've got around us? I don't believe our systems today can really do that for us. It takes a lot of work, or it takes a statistical person in the back room that says, I've got a question, can you help me understand what the correlated values are, and how do we understand that? Or the researchers. It's not at your desktop, it's not at your fingertips, it's not at supervisor or caseworkers' fingertips. And I think AI or NLP will allow us to do that. It is a paradigm shift. It is different than what we're looking at now. It is not computational in the way we've done it. So about 3 or 4 years ago, 2016, we started thinking about this relative to the technology that we were hearing about. And one of the things that we did is we actually did a series of roundtables across the country, talking to workers and caseworkers and supervisors about if you could use this sort of this magical technology that could actually read words and look at correlations across millions of documents, would that be helpful to you? And of course the answer was, oh yes, that would be great. You know, I'm swimming in data, I'm swimming in reports. If I could get some help to help me make better judgments, that would be terrific. And so that was the basis of this paper, to say what would the world look like if we could actually apply this technology, which was just kind of evolving into the consumer market back then. At the same time, there was this national Blue Ribbon report that came out. You may be familiar with it, a national strategy to eliminate child abuse and neglect fatalities. And it wasn't a positive report. It was in many ways saying, we don't have the systems to do this, we don't have the data to do it, we need to advance more quickly. So these two things kind of came together at the same moment in time. And so I'm going to speed up a little bit. I'm not sure how much time I got left here. Got a timekeeper? 15? Oh, great. So as we looked around the field, we didn't really see anybody doing anything specific to AI or NLP in this space, right, in social and human services. It's happening in banking, it's happening on your phone, it's happening in publishing and manufacturing. People, it is, if you go spend a minute Googling it, AI is everywhere now. It's everywhere. But it also is industries and program specific. You can't take a manufacturing AI solution and put it into somewhere else. It doesn't work that way. It needs to learn, specifically, it needs to learn on the information and the data of the system that it is being applied to. And so no one had done that yet in the child welfare space or in the human services space all that much. Without getting into the details of it too much, there's different levels of artificial intelligence. Some people would say your computer is actually artificial intelligence, that you can do computations using your computer. It's a machine that's helping you make decisions. But you can go down further into this in terms of machine learning and then deep learning, where the machines actually learn on their own once we've trained them to look for patterns. And that's where, of course, we need to be very careful on how we train the machines and address issues of bias and institutional racism and those kinds of things in terms of even the kind of questions. So there's a lot of thinking going on there. And I'm a big proponent of walking carefully and slowly into this work so we get it right. Because if we get it wrong up front, we're screwed, as they say. Because to undo that is really difficult. And so we felt actually some obligation to think about it from the ground up, right? Not to try to bring something to this space and apply it. And so that's what we've been doing in terms of, I helped launch a AI company last year, And we're working with 3 New York City agencies, foster care agencies, to white sheet from the blank sheet, actually talk with them about what it would be, what usefulness would this bring to your agency. And so we're in the process of building some of those applications to see purpose-built for this field. How can you actually apply it? And what AI allows you to do, in particular, natural language processing, or NLP, allows you to do, it actually can read language. It understands grammar, it understands language in a way that is mind-boggling to me and most people, but it actually can parse through language and summarize it and then provide feedback about things. So one of the things we're doing is looking at actually case plans and case notes, right? How many of you have to deal with case notes? How many of you love dealing with case notes? Here's 15 cases, right? Somebody's on vacation or you get a new worker, thousands and thousands of pages. So what we're hopeful about is being able to use this technology to actually read through those case notes, summarize those notes, and to provide insight to the worker or the supervisor about what are the key elements going on in that case in a very quick way against a timeline, and to be able to do analysis to show, looking at the kind of language that's being used, whether or not it's things are trending more positively or things are trending more negatively. So you now have some insight to the notes that are being written with help from this NLP that's being trained by experts in an organization or in a system that allows us to bring the collective intelligence to this work. It's an incredibly exciting opportunity to want to improve the usage of those notes. And there are estimates people are spending 50–60% of their time actually writing case notes. It's a lot of work to be able to go through those and to really pull out any kind of information in those. And so this is a place that is on the horizon for everybody. It's gonna arrive very soon and very quickly. The more we're able to participate in this, I think the more we're going to be able to shape what the future looks like. And we hope that that's something that we'll be able to participate in. There's, again, a video here that if you go onto this, you can take a look at it. I think I said much of this already, but not only is case note arduous, but being able to make sense out of it is a difficult thing to do. Case notes written notes are considered unstructured data, right? And for those of you who don't know that. The stuff in the drop-down boxes and those opportunities are structured data. Structured data we can do a lot with. Databases, as we know them now, deal with structured data incredibly well, and you can do a lot with that. The problem is structured data, according to many estimates, is only a fraction of the information that we're dealing with. It's the unstructured stuff, like case notes and electronic health records and those things, which are the dominant amount of information that we're dealing with, not only in our field, but more broadly across the country. And there's not really any good tools to use that today. AI and NLP and deep learning are a way to use that in many, many innovative ways. One example would be, not only would you be able to summarize the note, you can actually look for patterns in the notes, right? Is that the same note that has been presented the last 8 weeks, right? Are there, can you search the information for information about psychotropic drugs? Can you search it for who's in the family, who's been there, who should not be there? Can you actually match a worker with their psychosocial attitudes and approaches and experience with a family more effectively? Because now you've got a way to sort of match those things up and say, here's a presenting set of characteristics, here's our whole set of workers, who would make a better fit? Again, it's not replacing human judgment, it's not replacing decision making, it's supplementing and augmenting it, which is why we call it augmented intelligence. It's an assistance to what we're doing. This is just a screenshot of a summary, which we don't need to get into too much. So that brings us to what I really want to talk about, which is the National Interoperability Collaborative. So a lot of the stuff I talked about, and I'm just summarizing all this work, really was the driver for saying, what can we learn? What have we learned? How do we share that? And I've been frustrated over the years because we keep recreating that work. We keep sort of reinventing it, and we don't have a means to actually share that effectively today. And so we were finally able to develop, oops, sorry, I'm going to go through this. I'm going to come back to this in a second. So the basis for the NIC was this idea that if we could create a virtual hub for folks, would they come? Would they come and would they participate? Would they share their stone soup ingredients so that we can learn from one another? And the answer is yes. So about 1.5 years ago, we built this thing. It's a platform, so it's very available and readily accessible to folks. And what we intended to do was to create this virtual watering hole. So people from across the country could come, they can share their experiences, they can read, they can contribute to conversations, and they could also work with and connect with other people across the country. And given that I have a limited amount of time, I'm going to let you actually binge watch all these videos over the weekend because they're fascinating and you're going to love them, and they tell you more about what it is we're doing. So we talk about the NIC as a community of networks. As I described before, there are these various domains that we're working in. We talk about human services, health, education, public safety, and healthcare. These are major areas, and within each of them, there's a whole universe of activity. When you begin to look across these different domains, you begin to see a lot of parallels, that the problems that health is dealing with, we're dealing with in public health or public safety. And so we were able to do a little bit more research on that, did a paper on this for a major national association, looking at the areas of convergence and divergence across these different domains. But when you're dealing with an issue like children, mental health, or dealing with opioids or any particular crisis, what you'll find, as you know, is that there's an intersection, an interaction between some or all or more than these domains. How do we wrap our heads around that in a way that allows us to understand what's going on across there, right? How do we know what they're dealing with? What are their standards? What are their laws? Those kinds of things. So the fundamental basis of the NIC is really to say, let's create a place where we can have these cross-domain conversations. We can have vertical conversations about what's really relevant to our particular area of interest, but more importantly, how do we start to stage that conversation across domains? That was something that was relevant and pertinent to the Kresge Foundation, and they were generous to support this work as we've been building it out. And I'm here to say we're bringing it to California, and we're hopefully bringing it to this organization as well so that we can begin to do that. Right now, there's approximately, we launched it actually in about 1 year ago. There's almost 900 members. There's 8 groups. There's over 1,000 resources. And what we're finding is a huge engagement rate. So people are coming to this thing and they're looking at 6, 7, 8, 9, 10 pages on it, which is pretty much unheard of on a, this is not a sports site, this is not a shopping site, this is not an entertainment site, guys. This is a work site, right? Not on other kinds of sites either. So we have to manage our expectations around engagement. What we're finding is people are coming, they're engaging. There's been over 100,000 page views of this. And importantly, and most recently, people are coming and having conversations. So over the last 4 months, we've stood up a group called Let's Get Technical, and we're bringing about anywhere from 30 to 100 people every week to have literally every week for 1.5 hours, to have a conversation about one of these domains or parts of these domains so that we can begin to socialize this across the country. So we begin to learn each other's vocabulary and we begin to share that information more broadly. So that's, as I said, that's the Let's Get Technical group. Everybody is welcome to join it, and we'll share some information for you, with you as we go forward on that. And before I close, I just want to say that this is one of the more inspirational and exciting parts of the work that I've done for a long time, which is to actually create an opportunity for people to share their information and their knowledge. One of the things we found when we first started doing work in California was what I mentioned earlier, was that there was no visibility between what people were doing in different places and how that was able to, how could we actually bridge those gaps. And I think that this is a way to be able to do that. And I'm excited about that. And I hope that we are able to bring some of that to this organization as we go forward. And so just with the last thought I want to leave with you here is this equation. Anybody is a mathematician, want to solve this equation? L is greater than or equal to C. Any guesses? Back of the room. So I'll give you a clue. L is equal to learning. Oh, yes, I heard the word change, right. So learning has to be greater than or equal to the rate of change to survive. We're in a universe and an environment that is changing by the millisecond. And the only thing that on the private industry side that's valuable to companies is how quickly they can learn and adapt. I believe those same things are relevant to us here. How do we adapt to the change around us and as quickly as we possibly can? And what I like to say is that collaboration, which we heard a lot about yesterday, is an unnatural act, as I said, somebody said so eloquently. It's an unnatural act, and it takes concentration, it takes effort, it takes commitment in order to do it. It's not like coding. It doesn't happen on evenings and weekends. It happens during the work week. And I think when we will get to a place of greater collaboration, when it becomes part of people's work life, when you're sitting on your computer and you're participating in this, and your boss comes by and they say, oh, what's going on there? As opposed to you sort of hiding your screen, right? So I like to think about sort of the Google 10% or 20% idea, which is how do you take time out of your work life, whether or not it's 5% or 3%, half an hour a week, to collaborate. Because it is really, in many ways, that stone soup idea. 5 people spending 10 hours a week is very different than 1,000 people spending 15 minutes a week, or 10,000 people. The power of that, of sharing ideas, just gets multiplied so much by the contribution and the participation of a much broader audience. And so I encourage you, whether or not it's on this platform or others, to actually invest the time and work with your supervisors and to work with people who work for you to encourage their participation in that. And with that, I think we're done.